You're live, Tracy.
Hi, thank you for joining us today for the community conversation around COVID-19 in Pitkin County. I'm Tracy Truelove, and I'm the Public Information Officer for the Incident Management Team. Today joining me, I've got BOCC Chairman Steve Childs. I've got Karen Kenneman, with the Director of Public Health. We'll also be joined by Aspen Valley Hospital CEO Dave Ressler and Dr. Brad Holmes. And then we're going to wrap up our conversation today with Pitkin County Manager John Peacock. Again, I'm going to remind my panelists to even say your name one more time when your turn is up, just so that our radio listening audience can find out who is sharing their information today. So with that said, again, thank you for taking time to join us, and I'm going to kick off with Karen Kenneman. Oh, I'm sorry. I'm going to start with Steve.
Thank you, Tracy. I'm Steve Child. I'm chairman of the Board of County Commissioners. I hope that this finds all of you well and not sick in bed. The COVID-19 pandemic is presenting an unprecedented challenge to our community. To save lives, Pitkin County has executed public health orders that have been among the most restrictive in the state and the nation. Our community has acted to protect each other, our healthcare workers, first responders, and vulnerable members of our community by practicing social distancing and being compassionate and supportive of each other. I want to express my sincere gratitude for all that everyone is doing during these unprecedented and difficult times. There's no place I would rather be than here in our beautiful valley. Earlier this week, Governor Polis announced that the state will be moving from a stay-at-home order to a safer-at-home order beginning next week. This has led to some confusion. To be clear, the Pitkin County's public health order to stay at home is in place until April 30th. At this point, that we don't know whether that will be extended or will change, but it will be different than the state's safer at home order. It is important to remember that the county's public health orders are the rules everyone in Pitkin County needs to follow. You can find the county's updated public health orders at www.pitkincounty.com. Today, Pitkin County's new public health order has gone into effect. Certain activities will be allowed to resume under strict COVID-19 safety plans and guidelines, including construction projects, landscaping, golf courses, bike maintenance, and office supply retailers. We will monitor how reintroduction of these activities affects COVID-19 spread in the community and will make decisions based on data and protecting the public health and well-being of our community. The Board of Health will be meeting early next week to discuss the future of the county's public health orders and our strategy for incrementally returning to more normal activities based on science and the social determinants of health. One of the most important things that people need to do is wear your face masks when you are out in public. If a person is sick or if a person is healthy, it helps prevent the spread of the virus from one person to the other. So please follow that guideline. It's kind of fun having different color of bandanas, of face masks, homemade face masks. It's very important that people do that. So we are excited today to talk about the next steps in our fight against COVID-19. And I'd like to turn this over to Karen Kunneman, our Director of the Public Health Services. Thank you.
Thanks, Steve, and good afternoon, everyone. I'm going to do a quick sound check. Can you hear me okay, Steve?
Yes, I can hear you fine.
Great, thank you. I'm Karen Kenneman. I'm the Public Health Director, and I'm one of the incident commanders here in the Incident Command post. I think I want to start out today and just letting folks know that today's presentation and discussion with Aspen Valley Hospital and John Peacock are really some opportunities to share with you that there are a couple lights in the tunnel. I don't know if we can predict the light at the end of the tunnel for this, but there are some shining lanterns that we're going to be sharing with you today, and I truly hope that this helps everyone to know that we are really making our decisions based on data and science and what we truly believe is what's best for the public health and the whole community. And so I'm excited to be able to share a couple of things with you today with our partners here in this community meeting. I do want to take a little step and just go back to talk about more strategy and where we are now. And this is a little bit of a repetition for those of you who have listened to other community meetings, but I think it's important to talk about because not everyone is able to tune in every week. So just to sort of frame this up, we have two toolboxes in our public health toolbox to work toward ending a regional or local outbreak, epidemics, pandemics. And I'm going to talk a little bit about those two tools today and how we're going to utilize one of these tools to really be able to move toward, we call it a new normal, but to move toward, in essence, easing the public health order in a safe, cautious, and effective way. And so, again, I'm going to frame up these two tools for you right now. A traditional method that we always use in public health is that of identifying someone who has an infectious disease through testing folks, isolating them so that the disease doesn't spread to other people, and letting people who have been in contact with that person who has the disease, that they might be also at risk for that disease, and then having them quarantined until they're able to be tested. So we use that ubiquitously in public health as kind of a foundational public health strategy, and we can use it for everything from hepatitis to tuberculosis to COVID-19. With the new virus, SARS-CoV-2, and the pandemic, that traditional method was really overwhelmed, I would say nationally, globally, locally, statewide, and that the kind of testing that was developed, and realized that, China was the first country to actually develop the test for SARS-CoV-2. It's a viral, test to see when the genetic fingerprint of the virus, when you actually have the virus in your body, we call it PCR testing. Those PCR testings test supplies have really been in short supply, as has necessary PPE or personal protective equipment, and then lab capacity to run the test and get the results in a timely fashion. And I would say that that's been happening, again, nationally, statewide, and then locally. And so by putting the public health order in place, we really used a different tool in our toolbox, and it's really a blunt suppression tool to have the same effect as that traditional method. And in essence, we ask people in the community who are sick to stay at home, to isolate, and those who might get sick to stay at home and quarantine so that you don't get sick. And again, it's a kind of a blunt tool that's across the whole population. It's not individualized like the other traditional method I mentioned. So the stay-at-home strategy bought us some time. It bought us time locally to build the necessary PPE to cover a surge of patients at Aspen Valley Hospital, as well as enough PPE for testing. It also allowed us to build up time to get the necessary PCR testing supplies for our community. And over the last weeks, the state of Colorado has been able to increase their testing capacity as both the state lab and private labs are able to get test results faster back to the community. So all that's been happening really, and think about this, our first case was almost 7 weeks ago, and we've been building toward this since then. now that we've had some tremendous success in the suppression strategy to significantly slow the spread of the virus, and we see this through data like ICU data, mortality data, numbers of folks presenting at the ED, there are some criteria. We have the criteria really to be able to do a cautious and slow ease of the public health order and pivot back to that traditional method of disease containment that I mentioned in the beginning. But in order for that traditional method to work, we really have to have this box-it-in strategy in place. And so I'm going to talk a little bit about that, and the hospital is going to talk to that as well. This is one of our lights in the tunnel, is this box-it-in strategy. It allows us to go back to a containment mode where we're doing more traditional public health. And what we found is that all of those things that I said were lacking really in the last 7 weeks, we've been building capacity in our community to really be effective in this box-it-in strategy. And this box-it-in strategy is going to be the first step in easing the public health order more, and to really look at getting back to a little bit more normal way of being. But I want to caution that, you know, we will have a new normal in our community, and I'll talk a little bit about that. So when we look at the box-it-in strategy, this was developed by Resolve to Save Lives, which is a global public health institute. The former director of the CDC, Dr. Thomas Frieden, is the CEO of that. And they've done some really amazing kind of work around projecting and explaining public health principles. And so we're using their model here. In regard to that, next. Sorry, we're just going to advance to the next slide. Next one. Okay, so here it is. These are all the essential actions that need to be happening in a box-it-in strategy. So you can imagine that the virus is in the middle of the box, and all four lines of the box have to be solid and connected to keep that virus in the box. And so when we think about testing, you know, there's been a lot of talk about we need more testing and what does testing look like. Testing, and I'll talk a little bit about the value of testing in this epidemiological standpoint or public health standpoint. It only is effective if we have all four corners of the box in place and ready to go. So when we talk about testing, we're talking about the PCR testing, the test that tests for the virus currently in the body, means someone is actively having COVID-19. And what we really want to acknowledge is that when we talk about testing capacity in our community to be able to do this box-it-in strategy, we're talking specifically about PCR testing, not antibody testing or serology testing. That kind of testing doesn't fit in this strategy. It provides us surveillance or prevalence of the virus in our community in the past, but it doesn't allow us to get to this box-it-in strategy. So I want to be really clear when I'm talking about testing, I'm talking about PCR testing. So what we need to be able to do is we need to be able to test widely in our community. That allows us to understand who's actively infected and how then what happens after that. So then we pivot to isolation. So someone who tests positive, we have a public health system that really, I won't go through all the details, but it really allows us to be able to say this person is tested positive, and now we're going to, within our public health system, know that, and we're going to contact them, we're going to say, hey, you know, now it's time to go ahead and isolate so that you're not spreading this virus to others. And so we're going to put together isolation orders, mandatory or voluntary isolation orders to say, okay, you got to stay at home. And then we're going to go ahead and we're going to find all the contacts that associated with that person and let them know that you might well be at risk for being sick, and we want you to go ahead and we're going to ask you to also remove yourself for a while so that we can see if you become symptomatic. And then finally, folks that are in that realm are going to be quarantined and they're going to stay at home again until we find out if they're symptomatic or not, and then they would we would want to go ahead and test them. So it's this box-it-in strategy that allows us to really understand and be able to contain the virus in a different way than the public health order does. So as we ease the suppression of the public health order in phases, we have to have this system in place because, again, it's going back to that traditional method of removing people from interacting with others so that we're not getting the spread of the virus. There are a number of things that I mentioned that we've been doing to ramp up for this box-in strategy. And again, the hospital will talk specifically about the testing ramp up and what they're going to be doing around this. And then we've been building our, you may have heard, like an army of contact tracers. And so we recognize that in order to do this at this robust fashion, where we're really looking at, again, a pandemic where we just need all hands on deck, we're building a team of contact tracers that are going to be able to do the isolation, contact tracing, and kind of quarantine parts of this box. So we've been building up that capacity recently to be able to do this box-it-in strategy and be able to consider easing more of the public health order. So at that point, I'm going to go ahead and turn over this to Dave Ressler and Dr. Brad Holmes to talk a little bit about ABH's testing strategy.
Good afternoon. Can you hear me okay?
Yes.
Great. So, great. Thank you. I'm Dave Ressler, the CEO at Aspen Valley Hospital, and I'm very excited to be having this conversation today. This is a plan that we at Aspen Valley Hospital believe has true merit, and it is going to be an important part of restoring this community's vitality. And so the hospital is extremely pleased and proud to be participating in it. So I think it's that there is great benefit to to achieve over the past weeks, which our hospital and our healthcare services in the community against the surge that could potentially overwhelm our resources, as we talked about many times. Even though we remain ready, and I can tell you our plans are in place and they're constantly being updated, but we hope we never have to pull them out and utilize those plans by boxing in the virus and not allowing it to spread and create the surge for us. So the time is right, and I just have to echo Karen's comments that we too at the hospital have been conserving our resources in preparation for this day, and that is over the past few weeks we have been able to conserve our PPE. We've been able to maintain a healthy staff. As of today, we have only 5 staff members that are out with COVID-related symptoms. That's down from over 20 just a couple weeks ago. And so we also have our swabs, and we're ready. We're ready to help. So the second point I would also echo is the community's cooperation. I think we've been saying this for the last several weeks. Because you've abided by and embraced the importance of the social distancing and all of our very difficult and painful measures, we now have a very low incidence of the virus in the community, as evidenced by, as of for the last 24 hours, we had 0 patients coming to our emergency department, 0 with COVID symptoms.
Hey, Dave,
we have 1 patient in the hospital as of today, and
Dave, we lost you
sorry?
right after you're mentioning 0 patients in your hospital.
Okay, great. Thanks for letting me know. 0 patients in the hospital. 0 patients in the emergency department. 0 patients in our respiratory evaluation tent. 1 patient today in the hospital. So we are clearly, and this has been the pattern now for the past couple of weeks. So what does that also mean? It means that when we initiate the testing, We aren't going to have to do that many. And so we're not going to have to waste resources doing too many tests because we've been able to suppress it and reduce the number of tests that are going to be required related to the incidence of the virus in the community. So it's manageable now. And for our resources to be able to take care of and test the patients consistent with this new strategy. So how are we going to implement this? As Karen said, this is a PCR testing. Dr. Holmes will talk more about the testing specifically, but what does it mean for our community? It means for you, if you have COVID-related symptoms, contact your primary care physician. Just like we all along when you need help with symptoms, now if you even have minor symptoms that are COVID-related, contact your primary care physician. Or if you don't have a primary care physician, as we've been saying, contact our primary care practice here at Aspen Valley Hospital. We would be happy to see you. The primary care provider will schedule an appointment at our respiratory evaluation tent, the same tent we've been talking about all along that was stood up outside our emergency department. So we will schedule an appointment for you to come in and have your test. And the test will be administered by our same staff that have been seeing patients with more moderate and severe symptoms. We have the PPE, we have the safe environment, and we have the means to do the specimen collection here on site at the respiratory evaluation tent. It will require a physician's order, and the results will be provided back to the physician as well as to the incident management team and public health for the contact tracing that Karen just described. So let me make one other thing perfectly clear. We want you to be tested. In order to keep the virus within the box, we need people with symptoms to contact their provider, be referred to us, and we will not let cost be an issue. Many insurance companies cut anyway, but what we are committing to as a community hospital is to say that if you don't think you can afford it, call anyway. We will make it work for you. We will not let cost be a barrier for you. We want you to be tested so we can contribute to this excellent plan, the Box It In strategy. So hopefully that gives you a little bit of a sense for what it means as a community member that may be out there with symptoms right now. And I'm going to turn it over to Dr. Brad Holmes. He has been involved from the very beginning. Many of you have heard from him. Colleagues have provided essential information to this process for us to be able to make the right decision. So Dr. Holmes, thanks for being with us this afternoon, and I'll let you take it from there.
All right. Hi, everyone. My name's Dr. Brad Holmes. I'm an internal medicine and pediatric physician at Aspen Valley Hospital. I am one of the physicians who has been taking care of all the patients who have been in the hospital with COVID-19. And I've been, as Dave mentioned, involved from the beginning with the hospital strategy, and recently been working with the county for testing and other strategies. So I've been asked today to kind of discuss testing within the framework, within the strategy of the Box It In. And I was on a few weeks ago and talked a little bit about the antibody testing and PCR testing, and I'll bring it back up. But it's important to know that the testing is just one wall or one corner of this box. So it's an important part, but it's just one aspect of it, and all the others are just as important as well. And as Karen mentioned, the testing that we will be doing is PCR testing. And so this is the test where we use a swab up the nose, and what it does is it actually detects the virus itself. I like to think of it as it detects if you have the virus, versus the antibody tests, which have been in the news a lot lately, and we've discussed before. The antibody test is a blood test, which really looks for antibodies, which is essentially the body's response to the virus. And this can take a couple of weeks before it becomes positive. So I like to think of this one as you have had the virus in past tense. So the goal for this strategy is to find out who has the virus. We need to know who has it now so that we can contain them, we can isolate them, they can have their all contacts be traced, and those people can then be in quarantine. Unfortunately, the antibody test is more of a past tense, who has had it, doesn't necessarily tell you if you currently have it. So it is unfortunately not the correct test for this strategy. I will mention also that you'll probably be hearing about different types of tests coming out over the next few weeks, maybe even over the next days. There's a lot of things in the news. We are exploring a lot of different opportunities. You will continue to hear things about blood testing and the swab testing in the nose. There's saliva testing that is in the news. So these are all things that we are aware of, we are actively looking into, and just trying to find that we find the best test, as well as one that is actually available that we can use. I think the next question is really who is going to be tested. So as we said, we need to really be able to test as many people as possible in order for this strategy to work. So anyone with symptoms, we want to test. Dave kind of mentioned a few of the things about how you can do that, but if you are having any symptoms, and I think a lot of people have been reading about all the different symptoms, but the most common ones are fever or cough, shortness of breath, although there's other less common symptoms as well. But if you're having anything, any symptoms, any concerns, then I recommend that you call your primary care physician, talk to them. We are currently working on finalizing our criteria of exactly who will be tested. We won't test everyone that just has a runny nose for one day, so we will be ironing out those details, and we do want to test as many people as possible. But if you have anything that you are concerned about, call your primary care physician. And if you don't have a primary care physician, then please call Aston Valley Primary Care Clinic, the hospital's clinic, and we can make sure that we get testing arranged if it's felt that the test is needed. Some other questions that I have been recently coming up that I've been hearing about and I thought would just be important to address quickly would be, there's a lot more questions about the antibody testing, the A2 test that we've seen in the news, and especially regarding immunity. We are learning more about these antibody tests on a daily basis, on a regular basis. Recently, we've seen statements from the FDA, from the state of New York, and even as of yesterday, the Colorado Department of Public Health have all made statements cautioning the use of these antibody tests. There's still the vast majority of them are still not fully validated. There's a lot of concern about how accurate they are, and so it has been recommended by these organizations and states to not really use them at this time to make decisions and determine if somebody has the disease right now. We are also concerned about whether they may give false positives and inaccurately tell you that you've had COVID in the past. So these are all concerns, and part of the reason why Aston Valley Hospital has recently made the decision not to use those tests, the antibody tests, for our patients that are coming to our hospital and tent and emergency room. These same organizations have made the statements that there is some potential use for these tests for epidemiological purposes and for trying to determine prevalence. So that may be an option, but the hospital, we are currently not going to be using those tests. In regards to immunity, we just don't know. So even if somebody tests positive, we don't know that the test is accurate, but even if you did have COVID before, we still don't know that you will maintain immunity and that you couldn't get it again and that you couldn't pass it on to other people. So I would just caution that if you have had an antibody test or do have one done at some point in the future, if it says you are positive, just be aware that you may not be immune, that you still may get it, you still could pass it on. We're going to continue to learn more about that as time goes along, though. Another good question that has come up, and especially pertaining to this strategy, is what about people who are asymptomatic and have COVID disease? We know that there is a percentage of people that will have COVID-19 and be asymptomatic, will have very minimal or no symptoms at all. And ideally, we would like to test every single person in an ideal world, see if they have asymptomatic disease, but that's not really feasible or possible or have the supplies to do that. So we know and just have to accept that there will be a percentage of people that may be out walking around with COVID-19 who don't have symptoms and could still spread the disease. So that's why it's very important to continue to follow the recommendations that the public health department puts out. It's important to social distance, to stay at home, to wear the face mask, and do all these things that will limit the spread, even if somebody does have the disease and doesn't know it. We also know that there will be people who are tested and test negative. I think previously on my last talk on here, I mentioned that these tests are not perfect. We will have some what we call false negatives, meaning somebody who has the disease and the test will come back negative. Again, we wish this wasn't the case, but that's why it's very important that if you are sick, if you have any symptoms, that you should stay home, regardless of whether you tested positive or negative. You should remain isolated. That will help limit the spread of that disease, even if you did test negative. So these are all important concepts for this strategy. One other thing that we wanted to make sure that we get the message out is that we are expanding testing for this strategy to include people with mild symptoms, with any symptoms. But we are still seeing people with moderate and severe symptoms that need to see a physician. So our respiratory tent will continue to see people who are sick and feel they need to be seen by someone. The referrals can happen through your primary care physician, or again, if you don't have one, through the clinic at ADH. And people with severe symptoms, if you feel sick and need to be seen right away, our emergency room is still open. We have all the appropriate equipment and can handle it. And we don't want anyone feeling like they should be staying home if you are sick and need to be seen. But for those of you with just mild symptoms and don't need to be seen immediately, again, we will be making this testing available through appointments in a similar manner. So I think just last final message, we've done a great job. We have brought the prevalence down. I can tell you, as the physician seeing everyone in the hospital with COVID-19, we have gone from seeing multiple patients hospitalized a day with COVID-19 to, as Dave said, we've had none the last couple days. So, we're doing a good job. Our public health order has worked. The prevalence has significantly dropped. But it's very important that we don't relax now. We need to realize that the loosening of the public health restrictions and the social distancing and wearing of face masks, these will likely be our new normal. And it may be a while, unfortunately. We're waiting for a vaccine to help develop herd immunity so that we don't have to continue to do all these things. But likely until that's available, this will likely be our new normal. So it's very important that we all continue to follow the guidelines, follow social distancing, wearing face masks. And again, if you are sick, please just stay home and call your primary care doctor or find a way to get tested. We're going to make this available. At the same time, we have reasons to be very hopeful. We've done a great job. We have seen over the last few weeks, and almost daily, we're seeing increased testing availability. We're seeing safer tests, safer in terms of preventing the spread to our staff. We're seeing better tests. We're also seeing more in trials coming out and some potential new treatments that may help us. And then, of course, there's the vaccines that are in development. So there's lots of reasons to be hopeful. But we're just asking that you continue to do what you've been doing, and please help us keep the virus in the box. Thank you.
Great, thank you, Dr. Holmes. I think at this time we're going to move to Pickett County Manager John Peacock.
Thanks, Tracy. And again, this is John Peacock, Pickett County Manager. Before getting started, just really want to thank Karen, Dave, and Dr. Holmes for such great information. It's really hopeful. Before getting into economic impact...
Can you hear me okay?
Oh, I was muted. It happens every meeting to me. I'll start over. Thanks, Tracy. This is John Peacock, Picking County Manager. And I just want to thank again Karen, Dave, and Dr. Holmes for such great information. It's really hopeful. My task today is to talk a little bit about the economic impacts of implementing the boxing in strategy. But before I get to that, I want to talk a little bit more about testing, because as many of you are aware, the county acquired 1,000 antibody tests from an Inglewood company, A2, which had received expedited approvals for distribution from the FDA. As Dr. Holmes discussed, tests that have received this rapid authorization for distribution have not gone through the rigorous validation process for full FDA approval. Because of this, the county has been conducting its own validation process over the past several weeks. And the good news is that the test in this limited sampling has performed well, but as Dr. Holmes discussed, there remain significant concerns with the accuracy and specificity of this antibody test. As a result, we have come to the conclusion that before using this test in the community, we'd like to see more validation from the FDA. Our goal is to do testing that our community can have confidence in. All energy now is focused on partnering with the hospital on PCR testing and building out our contact tracing infrastructure so that public health can be protected while we resume more normal levels of activity. And if and when further validation of the A2 test is given by the FDA, we'll look at opportunities to provide that test to the community. But going back to the previous speakers who talked about the testing, isolation, find and quarantine strategies to box in this virus, there will be a cost to do this and to build this infrastructure. We anticipate or are planning for 12 to 18 months before there's an effective therapy or vaccine. We hope it comes sooner, but all indications now are that that's a reasonable time frame for us to be planning towards. And so in order to fund the additional contact tracers, the army of people who are going to be identifying and implementing isolation and quarantine strategies, and to fund that base layer of testing, we anticipate that we'll need to make investments of anywhere between an additional $1 to $1.5 million, depending on how long these ramped up measures are needed. This is an investment we need to figure out. It's an investment we need to make because the economic and social disruptions caused by the COVID-19 pandemic on the other side of this are unprecedented in our lifetime. Just to give you a few indicators, in a matter of weeks, Pickens County's unemployment rate went from a really full employment rate of just around 3% to our most recent report of just being under 15%. We expect that to go up. This represents 1,700 people whose employment has been affected, and we, again, expect that to go up. Our community has been generous in trying to mitigate these impacts. I want to thank both the private sector and our municipal partners for providing funds for emergency cash assistance in partnership with the county. In April alone, and we're not done with April yet, we've already issued $1.3 million in emergency cash assistance to over 1,100 households and just under 2,000 individuals. Again, we expect these numbers to go up and these needs to continue unless we make the investments and build the infrastructure for contact tracing and boxing this virus in, and it depends on us continuing to have the community's cooperation to implement these strategies as we make incremental changes. This is our path forward. Future meetings will discuss the potential steps for incrementally easing our public health orders to start next week, as Steve said in our Board of Health meeting. I want to thank everyone again for your partnership. The community has been remarkable during a painful and difficult time in adhering to our public health orders and our social distancing strategies. We have a long road ahead, but that road is visible, and we're looking forward to continuing to work with the community to successfully beat this virus. Thanks, Tracy.
Thank you, John. Now I'm going to turn it back over to BOCC Chair Steve Child to kind of wrap us up, and then I'll get back on for just some more information for where you can find a recap of today's meeting.
Okay, thank you, Tracy. So today we've talked about the public health orders and how they are being modified somewhat. In Pickens County today, there are several activities that people can now start doing: construction, landscaping, bicycle maintenance, and golf courses. But each of these have to follow strict protocol. They have to submit a plan to the county to determine, to make sure they're following the proper guidelines for social distancing, protection of the employees, and protection of the customers also. And we've learned about the box it in strategy, which is kind of the next phase for us to be able to open the community up more to different expanded activities. So I'd like to thank all of the participants today. Dr. Dave Ressler, I call you Dr. Dave Ressler, the CEO of the hospital, and Dr. Bradley Holmes, and Karen Kunneman from our Director of Public Health, Tracy Truelove for your work on coordinating and communicating the various things, and County Manager John Peacock. It's been informational. It's important that people pay close attention to this and listen to our guidelines and follow them in order to keep this virus suppressed. And when there are outbreaks, and I'm sure there will be little outbreaks of it, that's when we want to box it in, and some people are going to be put back into quarantine at that time. If you don't want to go into quarantine, it's important to follow the social distancing guidelines. Cover your face with a face mask, wash your hands frequently, maintain the social distancing. If you don't do that, if you go to a party and all your friends are there and not following precautions, very likely somebody's going to get sick, and then all those people at that gathering will end up having to go into quarantine. And we don't want that to happen. We want everybody to stay healthy. We want this virus to just keep disappearing and going away from our community. So thank you very much for participating today. Everybody stay healthy, and thank you.
Thank you, Steve. Again, just to wrap it up with community, we really appreciate your time tuning in today. Our team will have a recap of today's community meeting, and you can find that on the Pickens County website or at the Public Health Facebook page for any information. Also know that the hotline is still active and working, and if there's questions you have that weren't answered here, don't hesitate to reach out to them. Again, thank you to everyone, and be well.